Do you have asthma, or does your child have asthma that is uncontrolled? How frustrating that can be, especially if you've already talked to lots of physicians and you've tried several medications and yet you still can't seem to get in control of your own asthma, which interferes with your life, or your child's asthma, which not only interferes with their life and your life, but it can have lasting effects if not addressed appropriately. I have found that as an asthma educator that many physicians are missing the information that found on this card. So come with me, we'll take a look. Hi, I'm Dennis Stanley, and I'm a registered respiratory therapist, but also a certified asthma educator. Having run an asthma clinic before, I was always surprised to find out how little our family practice physicians knew about the information needed to treat asthma. Now, they know the simple stuff. They may know that they're supposed to give you a rescue inhaler and maybe even a steroid to help you with the long-term problems, but many family practice physicians are not empowered enough to know what to do beyond. Well, the information on this card is something that I want to take a deep dive with you just a little bit. Now, the information, of course, is nerdy to be sure, but I want to guide you through it just enough for you to empower you to go to your physician and say, hey, doctor, could we try some of these things? This card, as a sample, as a PDF, will be attached in the description below, so you can learn how to use it, and I'll talk to you about some of the technicalities here so that you can be better informed and you can take this information to your physician and learn much about what you can do together to get control of your asthma or your child's asthma. All right, before we dive deep into that nerdy information on that card, I do want to just give you a couple of points of things that you can do to get better control of your asthma. And the main thing is you may need to talk to your family practice physician and ask to be referred to an asthma specialist. An asthma specialist is a doctor, but they've gone to greater lengths to understand the information that is on cards like this and the protocols used to treat asthma. And it's not that asthma is only treated one way. The protocols really specify different options, and many family practice physicians are not familiar with that. When you look for an asthma specialist, you might have to do a little bit of the footwork here. An asthma specialist is often an allergist. Not always any doctor can be an asthma specialist, but most commonly they're found among allergists because fundamentally asthma is an allergic type reaction to something, causing inflammation in the airways, and then inflammation stays around. Sometimes that inflammation is an allergy to things that are really obvious, things that are outside, things that are seasonal, but sometimes your doctor or your allergist, your asthma specialist, may have to identify specifically what you're allergic to so you can avoid those triggers and so that you can receive better treatment with the right medications. So just to reiterate, your family practice physician, though you love them and they love you, they're not always in the complete know with all of the asthma options that are available to you. My other recommendation to you is that you yourself become a little bit more of an expert of what happens with asthma. I know it's easy to think that because you have asthma, you must be an expert. But it's helpful for you to get a little bit more of an education to understand what are the components of asthma, how are they affecting you, and then what medications might be available. Very often you can go to your physician and say, can I try this medication? The doctor might be willing to try that. So that's why we really want to look at the information, for instance, that is on a card like this that talks about how to evaluate somebody and their level of asthma, and then of course how to treat them with the appropriate medications. I know you probably feel like you're becoming a healthcare provider yourself, but we've discovered in this world that the consumer or the healthcare consumer like you, the person with asthma or the parent of a child with asthma, does need to know more information so that they can go to their doctors and talk a little bit more intelligently and open up options for you as you learn how to treat you or your child's asthma. With that being said, let's just take a nerdy but deeper dive into what's on this card to empower you to get better control and to talk to your physician in getting better control of you or your child's asthma. All right, we're here with the card. Now, you may have just a couple of PDFs, but I showed you the card. That's because that's the printed version. There's two sides of the card, and you're going to familiarize yourself with a little bit of information on each side of the card. You're doing this as a person with asthma or a parent with asthma. Although there is information on the card and tests that you're not sure what they are, that's not the point. We're going to show you enough about this card on how you can use it to understand approximately that you are on the possible treatments or you are not. Very often, and this is true, this is a national statistic, most people are at a certain level they're unfamiliar with, and I'll talk about that, their level of asthma, you're not even sure what you are. And then when you look at the other side of the card, most people, true statement, most people are not on the right asthma treatment step. And therefore, 80 to 90% of all patients with asthma, especially in the United States, are not being treated well enough, and they have uncontrolled asthma. And that's the purpose of this card. So let's take a little closer look. Now I'll zoom in here a little bit closer, but one side of the card is really just meant to do a basic interview of yourself. Let me zoom in here and ask yourself some basic questions that we'll talk about in just a minute. And you're going to categorize yourself as intermittent, mild, persistent, moderate persistent, or severe persistent. And then when you look at the next card, and let me zoom in here, what you're going to do here, this is the part that's going to look really cryptic to you. Don't worry about that. But you're going to see, you're going to line that up with what you were. If you're a moderate persistent, then you'll look at some medications. You'll think, wait, am I on two things or am I only on one thing? And look over here. If you're an adult, you could be on, that bronchodilator, that inhaler you carry around, but you should have a second bronchodilator, a second inhaler, that it is inhaled corticosteroid. It's going to be called something zone, beclomethasone, cortisone, something. And so you can look at those different zone inhalers. Those are long-term effectors. But there's a whole slew of other medications that we'll look at a little closer in just a minute. But are you on a low dose or a high dose inhaled corticosteroid? That you could also be additionally on a long-acting bronchodilator or something called a leukotriene modifier or a xanthine medication, etc. You could also be on an immunomodulator, and there's lots of things that can be done. And so that's what we're doing here. We're just looking at these cards a little closely, only to recognize that we're not on some of the possible options there. Now I'm going to take a closer look at this card, if you'll just kind of bear with me. In fact, let me first go to the treatment card, or rather the classification card, just to show you how this works. This is the most important one that you can learn. What we're looking at here, if I zoom out here, is that you're going to look at yourself and ask yourself some questions. Find your age. Let's just say you're an adult or you're 12 or older. What you're going to discern here is how many times per week are you taking your bronchodilator medication? Or maybe you don't even have a bronchodilator inhaler, but you have symptoms. You can't breathe, chest tightness, you're coughing, shortness of breath. Both are the same thing. But if you're having those experiences 2 times a week or more, 2 times a week or less. Okay, I'll just cut this part out. Okay, let's take a look at this asthma severity classification card. This is the most important part. What you're going to do is interview yourself. If it's you with asthma, or if you're the parent with asthma, you'll probably know these things already. You're going to classify yourself as intermittent, mild, moderate, or severe, and then you're going to look at the other side of the card and see if you're on some of those or most of those medications. If not, got to see your doctor and have a conversation. But this first one is to decide if you're intermittent, if you're having 2 or less symptoms per week. Now, we could also say if you're taking your bronchodilator, your inhaler, 2 or less times per week, that's all you needed, you're probably in pretty good shape. We're going to call your asthma in control. So when we get up here that we're really more concerned. If you're needing your bronchodilator inhaler, or if you don't have one, but you're having symptoms like chest tightness, can't breathe, cough, those types of things, 3 to 6 times per week, or you're needing your bronchodilator 3 to 6 times per week, then you're going to be in the mild persistent category. You can also ask yourself, am I experiencing anything that I can't do? I can't walk up the street and go for a walk because I get short of breath. Mostly you're fine, but there's some things, a few things that you can't do. And then the other key one is how many times per month are you awakening because you can't breathe? Maybe you take a breathing treatment or maybe you don't. I don't know. But you've awakened in the middle of the night because you're having trouble breathing. If it's 3+ times per month, then you're in the mild category. All right, let's take a look at moderate. Now, moderate is that you're using your bronchodilator inhaler, your medication, or you're at least experiencing symptoms where you probably should be using one every single day. If you tell me you're using inhaler every single day, I'm going to say you're at least in the moderate category. You'll also have moderate activity limitations. This is one that you have to be honest with yourself, because you might have activities that you simply don't do anymore and you think you're fine, but if you're honest, you would admit, no, actually there's a number of things I would like to do, but I don't do anymore. And that could be a moderate activity limitation. And then you may awake 2+ times per week. So not just a few times a month, but once or twice per week or more. This could put you in the moderate category. And then finally, the most significant one is that you tell me you take your bronchodilator, your inhaler every day, or you need one every day. In fact, you take it all day long. You might take it multiple times. You just can't remember when you took it or how many you took today. That's called all day long. And then you may have awakened in the middle of the night all week long. Maybe it was 4 times, 5 times, can't remember the day, but it seems to happen all week long. And there are severe activity limitations. They're just literally things that you can't do. Can't go for a walk outside your house because there's a slight grade on the hill there, and so you don't do that. And so that's an activity limitation. All right, so that's the key part. But then what you need to do after you've classified yourself, you're going to turn the card over, and here's where you're going to find some nerdy things that you don't have to understand everything, but your doctor will. But you can look at this and say, well, I just said that I was in the severe category. If I'm an adult, I should be taking a short-acting bronchodilator, your inhaler, but I should have another inhaler with some high-dose inhaled corticosteroids, and I ought to also have another medication that's called a long-acting bronchodilator, and I ought to be able to consider another drug like Dupixent, you probably heard of that, omalizumab, dupilumab. Those are immunosuppressants, and that could be a whole therapy that you're going on. But what you'll find is that most patients will say, hey, I'm in the moderate severe category, and they're somewhere here in their dosage and their medication, so in the wrong part of the graph. All right, so that's the deep dive on this card. I hope that's helpful to you. What it's supposed to do is empower you to have just enough information to go to your doctor and say, you know what? I want to know if there's some other options, and I think maybe some of their medications might be available to me. And you may also say, could I be referred to an asthma specialist, specifically an allergist if possible, because they already know this information and they know how to talk to you about it. They know how to put you on this kind of medication and this effort. Well, I hope that was helpful to you. Remember, the more information you understand about your asthma, the more you will be empowered to seek the necessary care that you need that will help you get control of that asthma or the asthma of your child. If you liked this video or found it helpful, please comment, tell us what you think, and then also smash the like button. And then, of course, as Respiratory Sensei has a brand new channel, we're going to dedicate a portion of it to people like you, people with asthma or have children with asthma who just need to know more. And so be sure to smash that notify button so that you don't miss a future video. I'm Dennis Stanley with Respiratory Sensei, and we'll see you later.